Hey y'all, so I'm on my lunch break, just got to the car, about to eat this delicioso food here. And I have just a quick point that I wanted to talk about. So yesterday, I'm in the Psych MP, like I guess student group. I don't know how to, I think it's for just Psych MP students, Psych MPs, I'm not sure. And I kind of caught the tail end of this conversation and it has something to do with kind of like bullying on because somebody asked a question about getting into an NP program with no experience. So the way that the question was asked, you don't know if the poster is saying like no nursing experience period or no psych experience. It's really kind of confusing. And people immediately started bashing this person. Immediately started bashing the poster. So it brought me kind of to this idea, like, because when I commented, I'm like, listen, if you are a nurse and you've worked with patients, you've worked with a psych patient. Psych patients show up in every setting. Psych, mental illness, psychiatric conditions manifest in different ways for different patients. There's tons of different types of psych conditions. So 9 times out of 10, if you work with a patient, you work with a psych patient, right? So there's no need to be condescending. There's no need to act like one program is better than the other, even though truly there may be more value in one program to the other, but value is subjective. So you just never know. Anyway, there's no need to be bullying, rude, saying whatever, because apparently there was also some type of, comments about going to an online program versus a brick and mortar program. Y'all know I go to Chamberlain, and apparently that is frowned upon for some people, but I can tell you right now, I am a preceptor. I teach at a brick and mortar in an FMP program. So I feel like regardless of me going to Chamberlain, which I value Chamberlain's education, and it's not a cakewalk. You're gonna do some work. And also any program is what you put into it. But anyway, so I commented on there because I felt like I don't care what kind of provider you are, what kind of experience you have. If you are a judgmental human being and you are a condescending human being, you are the worst type of person to provide care for a psych patient. If I were a psych patient, I would not want a condescending, judgmental provider. I don't care how many years of psych experience you have prior to getting your psych certification as a nurse practitioner. If you are an asshole, if you have negative things to say about people you've never met based on a sentence or question, I don't want you to preside over my care. Period. You can't be that type of person. Now, on the other hand, I do understand that if you are going to be a nurse practitioner, should you have some sort of experience prior to becoming a nurse practitioner? Yes, you should. Yes, you should. And that, even though it may not be required, should you? Yes. And I don't mean just your experience while doing clinicals or your experience while precepting. I mean, if you are going to be an advanced practice provider, you need to have nursing experience somewhere. You need to have acute care experience. I don't care what department. You need to have acute care experience, in my opinion, to become a advanced practice provider. And the reason being is because how do you critically think? How do you connect the dots? Because what is in the book is not real life all the time. So you need to go and experience and think things through, because practicing medicine is not a joke. It's not a joke. So, and it really just brings up the point. Should a person with no nursing experience become a nurse practitioner? As much as I love people going into nursing. I love the field of nursing. But the answer, in my opinion, is no. Would I bash somebody for it? No, I would not. I would try to help them more. with that being said as well, I do experience nurse practitioner students nearly daily now. And to see a student who is in an advanced practice program that can't even tell you normal vital signs, normal ranges, y'all, it is mind-boggling. And it makes me wonder, why would you? And this is a question to ask yourself. If you are a nurse practitioner student, you intend on becoming a nurse practitioner, or if you are, brand new, whatever, why are you doing this? Why are you becoming an advanced practice provider without trying to go through, trying to gain experience, trying to gain the knowledge, the wisdom you need to practice medicine? If you are an LPN or RN, you follow orders. You do use your brain. Don't get me wrong. RNs critically think. However, ultimately, you follow orders. And how do you know if an order is kind of off? Because sometimes nurses, they have to tell doctors, oh, wait a minute, this don't look right. Or wait, why are you doing this again? And it kind of, it helps prevent errors. How do you help the doctor help yourself? Or how do you catch things if you never worked in that area? It is mind-boggling to me. Do I feel like psychiatric nurse practitioners need previous psych experience? No, I don't. Especially because a lot of times when you graduate from a nursing program, you just go wherever you get hired. Sometimes you don't get to go into the specialty that you really want. Sometimes you don't get to go into the department that you really want, but you want to be an advanced practice provider. You may get a job in ICU when you really do want it to be on the psych unit. Or maybe a psych unit isn't even available in your area. There's a lot of factors that plays into it. But baby, my advice, number one, don't become an advanced practice provider, nurse practitioner, PA, PA a little different. That's more on the medical track, medical theory. But don't become a nurse practitioner if you don't have RN experience, or don't become a nurse practitioner if the only thing you've done is home health care assessments, or the only thing you've done was school nursing. It's not the same, y'all. You're putting yourself at risk. You're putting the patient at risk. The learning curve it would be too much. Do yourself a favor, do your patients a favor, and take that time to go. There's no race to the finish line. Take that time to go gain the experience you need. Number two, if you are a psych nurse practitioner or you a nurse practitioner, listen, when jobs hire nurse practitioners, 9 times out of 10, they could give a fuck what school you went to. Really? They don't care like that. Did you graduate? Did you pass your board exam? And the thing about it, and this has, I don't know why there's like this superiority thing. It's so like crazy to me that it is still a version of nurses, being bullies, eating their young, however you want to say it. It's crazy how prevalent it is in nursing, but it is. One of the commenters said, when I have a student who has no previous experience, I pour more into them. You don't just shut them down. You pour more into them, and you don't pass them if they didn't deserve to be passed. There are people who are janitors, and they can tell you all about engineering, but they don't have an engineering degree. So I don't want to be too harsh about not having nursing experience, but should you? You should. And if you did have experience and you come across somebody that didn't, don't be an asshole. Don't be an asshole. Because, it's just not needed. It's not needed. It says more about you than it does that person who's trying to get the degree, or who doesn't have the experience, doesn't have the documented experience working in psych or working whatever. But anyway, that's my little, whatever for the day. I'm gonna eat my food because I don't like soggy bread. I don't like soggy things. So I just poured the sauce on here and I need to eat this. But get some experience before trying to wear this white coat. I'm telling you, get some experience. It's not trendy. You are becoming a medical provider. Like, do what you're supposed to do, please, in Jesus' name. Okay? Like, follow, I don't know why I want to say prescribe. It's because I'm at work. Like, follow, subscribe, comment, all of the things that, YouTubers ask you to do. Take care, guys.